because normally you need to know that what results to the closure of the pattern of the ductus arteriosus is when the child takes a deep breath. Is it clear? Since the child has not taken a deep breath, there's not going to be closure of that pattern ductus arteriosus. So of that ductus arteriosus. So there's going to be pattern ductus arteriosus. The next element, also a foramen ovale is not going to close. So you're going to have an atrial septal defect. Is it clear? So those are the different elements that you can have. See actually the cardiovascular system. Now for the respiratory system, you have just the apnea-bradypnea syndrome, or the apnea syndrome. Is it clear? So those are the different elements that you are going to have in the apnea-bradypnea syndrome. Is it clear in the respiratory system? Now in the after the respiratory system, you are going to have the GIT. The gastrointestinal system, when the child is going to have meconium, is it clear? We need to know that what generally the gastrointestinal tract is going to normally function. Is it clear? Also, when there is no birth asphyxia, when there is no hypoxia, the gastrointestinal tract normally function. It means that the child is supposed to defecate normally. There's going to be intestinal transit. But when there is birth asphyxia, there is only going to be a single primordial defecation that is going to be in utero, because the GI tract cannot contain the meconium because of hypoperfusion. So they are going to have a meconial stain. But later on, you are not going to have the defecation. The child is not going to defecate again. Is it clear? Since the child does not defecate again, it's going to be accumulation of the remaining meconium inside the gastrointestinal tract. That is going to result to meconial ileus. Is it clear? So you're going to have meconial ileus at the level of the gastrointestinal tract. Is it clear? Now the next element is that you can also have a necrotizing enterocolitis. So how can you have necrotizing enterocolitis from birth asphyxia or all these other pathologies? Is it clear? Necrotizing enterocolitis can have it from birth asphyxia by the fact that if the child feeds normally in birth asphyxia, there's going to be hypoperfusion at the level of the gastrointestinal tract. When a child feeds, is it clear, and when it's asphyxiated, what happens is that there is going to be an increase intraluminal pressure. Is it clear? That increase intraluminal pressure is going to compress. It's going to compress the blood vessel. It's going to compress the blood vessel that supply the GI tract. And when it compresses the blood vessel that supply the GI tract, it's going to result to a further hypoperfusion of the GI tract. And when there's a further hypoperfusion of the GI tract, it's going to result to necrosis. That's why we have the name necrotizing. And enterocolitis means that it involves the intestine and the colon. So it's necrotizing enterocolitis. Are you understanding? Now, the next thing pathology in the GI tract is going to be the stress ulcer. Is it clear? Stress ulcer occurs mostly when you have an instance of stress. Is it clear? Stress ulcer usually results when you have instances of stress. Is it clear? And when you have instances of stress, it's going to result to cortisol release, corticosteroid release. Is it clear? And those corticosteroid release are the ones that are going to result to reduce prostaglandin that is going to be involved with mucus formation at the level of the mucus formation at the level of the stomach. That's going to result to stress ulcer. So if there is blood, there is fresh blood that can be visualized in a clinical presentation, we can see that it's a stress ulcer. Now, after the gastrointestinal tract pathologies, you have the endocrine pathologies. The endocrine pathologies, you have hypercortisolism. Is it clear? So hypercortisolism. Why is there hypercortisolism? I've forgotten to also explain the fact that when there is an compensatory ischemic, there's a compensatory ischemic mechanism. You have to understand that when this compensatory ischemic mechanism, one of the noble organs after the brain, the heart, and the kidney, we have also the adrenals. Is it clear? The adrenal glands are also one of the major noble organs. So it's going to be hyperperfusion inside the adrenal glands, and the hyperperfusion inside the adrenal glands is going to result to hyperproduction of all the hormones which are located in the hyper release of all the hormones which are located in the adrenal glands, particularly cortisol, which is going to result to hyperglycemia. Is it clear? So those are the different elements. Now, the next element is that you can have, so those are the hypoxic disorders. Now you have also general system. Generally, you have also abnormalities. Is it clear? So generally, we have abnormalities as treated as complication, and those abnormalities you have electrolyte imbalance. Electrolyte imbalance are treated mostly as a result of reduced. So if you have hypo, you have elements like hyponatremia, you have hypokalemia or hypocalcemia, or also hypomagnesemia. Is it clear? Hypomagnesemia. So all these hypo as a result of reduced breastfeeding. Is it clear? It's another complication. So these are complications mostly associated with reduced breastfeeding. Is it clear? And not hypoxia. So hyponatremia, hypocalcemia, hypomagnesemia, hypokalemia as a result are coming as a result of reduced breastfeeding. So since the child is not breastfeeding from the first day of life, he's going to have all this hypo, and maybe as a result of the twitching later on in life. So that if the child is twitching after and is not eating, you may think of those hypoelectrolytes. Is it clear? Now, seeing the general system, we have other elements that the child may have. Hypoglycemia also associated with reduced breastfeeding. So you have also a pathophysiology associated with reduced breastfeeding. Is it clear? So hypoglycemia can also be associated with that. Is it clear? Now, also the next pathology inside general, which are associated with hypoxia, you have hypothermia. Hypothermia, why? Because there's a reduced perfusion inside so there's going to be hypothermia. You have reduced perfusion of the tissues. Is it clear? So the tissues are like the liver and all those other tissues. So you are going to have reduced heat inside the body, because the liver is the major source of heat inside the body. Is it clear? So you have also reduced perfusion of the adipose, which are also sources of heat, of insulation. Is it clear? So you have that's going to result to hypothermia from a hypoxia and ischemia of the body. Is it clear? So generally, we can also have an acute kidney injury. Kidney injury can also occur. Is it clear? Acute kidney injury can also occur, which is going to result to a hyperkalemia. It's going to result to hyperkalemia. It's going to result to hypernatremia, and also going to further result to acidosis. Is it clear? That's why we are now going to move now to the next pathophysiology. The first pathophysiology was the hypoxia resulting to ischemia. The next pathophysiology is hypoxia resulting to acidosis pathophysiology.